Medicare and Medicaid, our country's two main public health care programs, will impact just about every American at some point. Medicare provides health care to the elderly and disabled, and, right now, everyone over 65 is automatically enrolled in this program. Medicare is funded through federal expenditures and payroll taxes. Medicaid provides health care to the poor, many of them working families and the elderly. The cost of Medicaid is shared between the federal government and the states, but the services offered vary widely depending on the state. The Affordable Care Act, or Obamacare, offers much more funding to states for Medicaid, as well as attempting to curb costs for both programs. These two programs make up nearly half of all health care spending in the U.S. Both Medicare and Medicaid cost more than current revenues provide for, and both are plagued by fraud and waste, especially waste. So, as the costs of health care continue to rise, as our other expenses, like the national debt, continue to mount, and our baby boomer generation is added to the Medicare system, our way of providing health care for the poor and elderly has to adapt if it is to survive. The following three options present possible solutions on how we can face these challenges together. But each option also comes with certain drawbacks, ones we must seriously consider. Each of these options has evidence to support it, but the options are based on the core concerns of citizens on this issue. So, what are our options? Option 1. Do what it takes to maintain our commitment. This option says we should do what is necessary to keep our safety net strong, even if it costs everyone more. This could mean raising the qualifying age for Medicare to 68 or 69 and lowering the poverty level for Medicaid. Employers and employees could pay more in payroll taxes to fund both programs, while enrollees could pay a bit more in premiums and co-pays. We could also consider means testing Medicare, which means making higher-income individuals pay significantly more. We could even consider a cap on lifetime benefits. But raising taxes to pay for these programs could cost them their broad-based support. And raising the age requirement could force people to put off medical help, resulting in higher costs later. Could we live with that? Option 2. Reduce healthcare costs throughout the system. Option 2 says that we have to slow down the rising costs in our healthcare system. To do this, we could ask doctors to order fewer tests and prescribe fewer antibiotics overall. And we could require hospitals to post more cost information about procedures so patients could compare and price shop. We could also pay physicians a salary rather than a fee for every test or procedure. We could also change the way we handle the most expensive area of healthcare, end-of-life care, by making hospice care the norm for terminal patients. But if we limit a doctor's freedom to do what he or she feels is best for their patient's care, this may reduce the best outcome for each patient. Encouraging competition among hospitals could cause some good ones to close. And less end-of-life care may mean that some people die sooner than they need to. Could we live with that? Option 3. Get serious about prevention. This option says, to curb some of the trillions of tax dollars spent on healthcare, we should focus on reducing preventable illnesses caused by behavior and lifestyle. To do this, we could charge people who smoke, drink, eat too much, or don't exercise regularly more for their insurance premiums. Communities could provide incentives for farmers to sell fresh produce in underserved neighborhoods. Families could take more responsibility for elderly folks and the disabled, keeping them at home rather than in nursing homes. Medicare and Medicaid could fund programs to help keep elderly folks in their homes. But this option would invite a lot of scrutiny, some of it unfair, towards people suffering from diseases like diabetes and heart disease. It could also result in inadequate care for the elderly and people who need skilled nursing. And many people would see insurance providers mandating a healthy lifestyle as an intrusion on personal freedom. Could we live with that? These three options present potential solutions on how we could address the issues surrounding our struggling healthcare system. Sure, the subject matter is very controversial, but it is something that affects each and every one of us at different stages throughout our lives. To ignite the changes needed, we as citizens must listen to and voice our own concerns with one another. So, let's get talking.